Okay, so now we're going to talk about what happens when there's meconium in the amniotic fluid. So meconium is the substance that collects in the fetal GI tract throughout gestation. So the fetus swallows amniotic fluid, passes the water as urine, but also there's a little bit of solid material. There's vernix, there's hair, things like that. All of that, it collects in the GI tract, okay? Meconium has a lot of bilirubin in it, and so it's green, but it's actually so dark green that it's black. Okay, it appears to be black. So it's usually passed as the infant's first stools after birth. So for the first day or two, you get that black tarry stool. If that's diluted out, you can see that it's actually a green color from the bilirubin. So what happens if in utero the fetus passes some of that stool? Well, first of all, it's not like stool when they're outside. There's not bacteria. The gut is not yet colonized. So it's sterile or near sterile. So it doesn't cause infection in that way. So swallowing it is actually not the problem. People will say the baby swallowed amniotic fluid or swallowed meconium. That's not actually the problem. The real risk is that at birth or shortly after birth, they will aspirate some of it into the lungs. So we're going to talk about with the newborn what can happen there, but it can cause a really bad chemical pneumonia. So what are the things that make it more likely the fetus passes meconium in utero? If they're postdates, okay, if they're in the breech position, just because their belly might get squished and cause them to actually poop. If there's any condition that causes fetal hypoxia, so if they have preeclampsia, if they have poorly managed diabetes, if they have a cord in a place that gets compressed frequently, if they have other things that cause the placenta not to perfuse adequately, if the fetus gets hypoxic, that can relax the sphincter and cause them to pass meconium. Again, the major risk is during the birth process, if the fetus aspirates some of that meconium, they can develop pneumonia. Now, meconium aspiration doesn't always mean they're going to have that pneumonia. Meconium in the water doesn't mean they're always going to aspirate it, but the risk is there. So for management, a resuscitation team for the infant needs to be present at delivery. So we need a special care team at delivery just to take care of that baby. We used to try to suction all the meconium out of the mouth and everything before we allowed the baby to take a breath. That actually is not recommended anymore. It's not recommended that they suction on the perineum anymore. They used to deliver the head and try to suction the baby before the rest of the baby delivered. That's not recommended. If the infant is vigorous, if they come out, they're awake, moving, crying, all of those things, it's not recommended that we suction that baby. We just monitor that baby for meconium aspiration syndrome. That's it. But if the baby is delivered with decreased respirations, poor tone, or a heart rate less than 100, so they're showing signs that they're not really taking that first breath, then before we start bagging that baby, before we start helping them breathe, it's recommended to suction and get out as much meconium as we can. Make sure that that's not going on long enough to actually delay ventilation, because the goal is to get air into the baby. So we want to suction them quickly before that, and then do the resuscitation. Okay, the next section is going to be about chorioamnionitis.